All right. Well, good evening and welcome to Creighton University. My name is Dan DeLeo, and I'm a theology professor and director of the Justice and Peace Studies program, and I also chair the Department of Cultural and Social Studies. Tonight's event is sponsored by the 8 programs in our department, including Justice and Peace Studies, Sociology, and Public Health. And this event is also co-sponsored by the Environmental Studies program and the Sustainability Studies program. The views expressed here tonight don't necessarily reflect those of Creighton University. However, it's fitting in many ways that Creighton is hosting this event. In Creighton's Catholic tradition, justice protects human rights that safeguard human dignity and are defined as claims on, quote, the basic goods that every human person needs to live and thrive. Based on this definition, the Catholic Church stresses that every human person has the right to adequate health. Since pollution injures human health, the Church also recognizes the right to a safe environment. Justice also promotes the common good as the conditions needed to safeguard rights and for which public institutions fundamentally exist. In 1961, St. John the 23rd declared, quote, as for the state, its whole raison d'etre, its reason for being, is the realization of the common good. Finally, justice as equity exercises a preferential option for the poor and marginalized, those most vulnerable to violations of their rights, especially because of public policies. In this context, the Catholic tradition recognizes that pollution doesn't impact everyone equally. As we'll hear tonight, the poor and marginalized are often most vulnerable to cumulative environmental degradation in complicated ways. For this reason, the U.S. Conference of Catholic Bishops founded its environmental justice program in 1994. Over the past 30 years, the bishops have advocated, quote, to respond to environmental challenges, especially as they disproportionately affect our poor and vulnerable neighbors. Although the Catholic tradition is devoted to environmental justice, this commitment is not exclusively religious. OPPD's Strategic Directive 7 on environmental stewardship instructs the utility to, quote, recognize the importance of the principle of environmental justice in district decision making. To achieve environmental justice, SD7 also directs OPPD to conduct its business in a manner that meets all environmental regulatory standards and go beyond compliance where practical. This is because legal levels of pollution still hurt people, especially the poor and marginalized. For decades, North Omaha has experienced disproportionate layers of environmental injustice. Like many American cities, Omaha has a history of redlining that segregated communities of color into North and South Omaha. These policies cause disparate effects across variables that are correlated with increased vulnerability to environmental harm. For example, as we'll hear tonight, the Center for Disease Control's Environmental Justice Index, quote, measures the cumulative impacts of environmental burden through the lens of human health and health equity. Using this index, the CDC identifies 12 census tracts within 5 miles of North Omaha Station that are at high risk for the health impacts of environmental burden. Across these 12 CDC burden tracts, 46% of the population is Black, 36% lives below the poverty line, and there are more than a dozen schools. In terms of ethics and strategic directives, environmental justice calls leaders to seek policies that prioritize these vulnerable communities and go beyond regulatory compliance. To help us better understand these dynamics, I'll now turn things over to my colleague in environmental sociology, Dr. Ryan Wishart.
Thanks, Dan. So as Dan described, North Omaha has long been recognized by scholars and regulators as suffering from cumulative pollution burdens, for example, from Highway 75 North and the nation's largest lead contamination Superfund site. In addition, residents often bear those cumulative burdens with greater social vulnerability due to conditions of housing, access to health care, and other factors, including greater difficulty affording utility bills. In 2011, concerned citizens started engaging with OPPD about reducing health impacts from North Omaha's coal plant. By 2014, a coalition of organizations, including Sierra Club, Nebraska Interfaith Power and Light, the Malcolm X Foundation, Omaha Together One Community, and the League of Women Voters had convinced OPPD to commit to phasing out coal use at the North Omaha plant. In 2016, rather than being retired completely, as was initially planned, the first 3 coal units at North Omaha were converted to gas that year. This still resulted in major reductions in pollution, as they're used only infrequently. Until 2022, everything seemed on track for the final coal units, 4 and 5, to be converted to gas in 2023, and those first 3 units to be shut down entirely. In February 2022, OPPD completed an integrated resource plan with unprecedented public participation and feedback. OPPD projected that electrical demand would grow very slowly, and the coal phase-out would occur on time the following year. Many participants in this process suggested increased efforts to invest in conservation, particularly to manage times of peak energy use, as well as expansion of renewables and batteries to reduce emissions faster. However, just 6 months later, the board was asked and agreed to postpone coal phase-out for an additional 3 years to 2026. The justification for this was that construction delays caused by COVID and grid authority permitting backlogs were slowing down newer plants that needed to be brought online, and combined with rapid growth in energy consumption from data centers that could threaten reliability. That data center growth was being planned and recruited by various economic development actors, but was not shared with the public during the planning process earlier that year. And this data center growth is central to the crisis we're having here today and around the country. By 2023, OPPD, in contrast to flat projections a year earlier, predicted that electrical demand would double, and 90% of that growth was from industrial customers, 2/3 of that being data centers. Reporting on broken promises to phase out coal in North Omaha, the Washington Post noted that year that just Meta's single data center consumed about the same amount of electricity annually as North Omaha Station produced. And Google's energy consumption was even larger. Particularly in the race for AI profits, companies don't want to wait for electricity to power their new data centers. Around the country, instead of the largest companies having to wait for power, residents are being told they instead have to wait longer than promised for healthy air as old, dirty plants are run past their planned closure dates. For-profit utilities, generally, the more they spend, the more the profit they make, so all growth is good to them, and they don't pay for the externalized health costs. But we're unique in Nebraska in that we have public power. Our electrical utilities don't serve investors, and their leaders are elected by the residential customer owners, not shareholders. Nevertheless, during the November OPPD committee meeting, staff noted that if the board approves their proposal to indefinitely postpone their public promise to phase out coal at North Omaha Station, there are confidential but specific big industrial customers that they would contact, quote, the next day, with new private promises of faster service and growth. So even with public power here, there's a clear tension between the health of the public and concentrated economic interests that our elected board members are under pressure to choose between. Despite repeated public assurances of being on track and a September report projecting a 99.99% reliability through 2030 with the coal phase out on schedule, in November, OPPD staff announced through the Omaha World Herald that phasing out coal on schedule would threaten reliability goals, particularly during winter peaks. During OPPD's November committee meeting, the Vice President of Sustainability and Environmental Affairs presented a report by the utility industry-funded think tank, EPRI, as meeting the board's directive to prioritize environmental justice, and characterized the report as, quote, a full-scale human health risk assessment. This assessment allegedly showed there are no significant health risks from pollution at North Omaha Station. Mr. Fleener also emphasized that OPPD welcomed feedback and dialogue in response to the report. Importantly, I think Director Moody clarified that the board's intention in their directive on environmental justice was for more than, quote, conversation and dialogue, but required OPPD to meaningfully incorporate environmental justice, quote, into decision-making. So now the board is being asked to vote yes on December 18th on a resolution to remove their currently standing orders to staff to phase out coal by the end of 2026, and instead authorize continued use of coal at North Omaha Station indefinitely. Our first 4 panelists tonight will share their expert perspectives on whether the EPRI report is truly a full-scale human health risk assessment that provides relevant information for the board's directive to prioritize environmental justice, and what other peer-reviewed research, including their own, already exists that can better inform decision making. Our final two panelists will also help us analyze whether it is practical for the board to keep its promise to take coal out of North Omaha and also maintain reliability and affordability for its customer owners. So our first public health expert is Dr. Corey Ruktanungchai. She's an assistant professor of population health sciences at Virginia Tech. She holds a master's degree in public health and a PhD in spatial epidemiology. Her scholarship focuses on environmental epidemiology and disease mapping, and she has published on health outcomes of coal mines in Appalachia. She wasn't able to join us live tonight, but has prepared some pre-recorded marks that Dan will play for us.
Thank you very much for allowing me to do this. Because I am I consider myself a health equity scholar. That is my area of expertise. And because of that, I'm going to be focusing my questions and feedback a little bit more targeted on Chapter 3, the inhalation human health risk assessment. I was really pleased to see throughout this risk assessment that the board has acknowledged that there are many different organ systems, many different biological systems throughout the human body that can be impacted by air pollution, not just respiratory, but including cardiovascular, nervous systems, neurological systems, things like that. I was very pleased to see equation number 2 that was outlining the respiratory HI. And one of my questions has to be with, despite the fact that this report does acknowledge that these systems can be impacted differently, the only feedback and discussion I really saw throughout the document had to do with that respiratory HI, which again, very important, but I was just curious if the board can elaborate on what analyses were done for other systems, including those cardiovascular, nervous, and neurological systems. It made a lot of sense to me that you would sum up those compounds of potential concern across those systems, but I was really interested to see more information on how those analyses vary between systems and within systems as well. So that was really my forefront question that popped out to me as I was reading this. Some of the other things that stood out to me that I wanted to address, again, having to do with the page, really specifically page 3-2 under the chronic HI section. Some really valid assumptions were made. For example, 70 kilograms body weight, things like that. You know, it makes a lot of sense that you would need to make those assumptions in order to move on with your analyses. But it was interesting to me because one of the things that stood out to me was that we know 70 kilograms in particular can be very, very drastically different, particularly in children, particularly in elderly populations. But really the children in particular is what stood out to me because, first of all, as far as I can tell, that was unaccounted for. At least it's not really explicitly laid out in Chapter 3. But the other thing is that I noticed that there is a playground, half a mile away from the plants that are in discussion right now. And I believe that's called Craig Park. You all would know that much better than me. But the thing that concerns me about that is that it means that there is a reasonable expectation that children are going about their day very close to these plants, and particularly with air pollution. There's the reasonable expectation there that they might be exposed to this, and because they are a different population, they've got developmental vulnerabilities, they've got different body weights, different body sizes, and we know that not all of these toxic compounds impact everybody equally, right? Like we know that lead, for example, is much worse for children. So my question is, firstly, what kind of analyses and populations were taken into account in these analyses? the way that it's currently worded makes me think that it's just an average person, which again, I understand where that assumption would come from. And yet we know that these risks are not distributed equally. Towards this, I did a little bit of research on, what are some of the asthma rates? What are some of the health conditions that impact this population? Not knowing a thing about Omaha, not knowing a thing about Nebraska in terms of demographics, populations, health conditions, thing like that. But what I did notice is that asthma is very, very, very high in a very particular part of town, which is very particularly close to these coal plants. So my question is, not just about children, but what about people who have pre-existing conditions like asthma? What about pregnant people? What about birth outcomes? What about the elderly? We know that risk is not created equal. Risk for one person can look completely different for risk for another person. And when I was doing this and I was beginning to, understand this population a little bit better, asthma popped out to me. And because of that, I started looking a little bit into what this looks like from sort of a more environmental justice perspective. What are the people who live in this part of town already facing? Regardless of any, future actions, regardless of anything, what are we looking at right now? And those asthma rates really stood out to me. That is what I would expect in, for example, West Virginia. And West Virginia has some of the poorest health outcomes in the country, has some of the lowest life expectancy. It has some of the highest rates of environmental justice burden. So people growing up, being born and living in a place where they don't necessarily have control over the environment, these things are happening around them, right? So I wanted to kind of quantify that a little bit more. I wanted to wrap my head around like, okay, these maps are telling me something, but what does this actually mean in numbers, right? And to do that, what I did is I turned to the CDC. The CDC has an environmental justice index that they put together. And the nice thing about this is that it's a variety of different measures. I mean, very similar, I'm sure, to the risk assessment that you all did. If you all want to, I'm not going to spend a lot of time talking about this, but if you all want to look at that, you can see this. But what I want to say is that the environmental justice score, it comprises a few different things. It comprises social vulnerability. So social vulnerability indicators will be included in that. It includes the environmental burden as well as health vulnerability. So it takes all of these things, puts it together to create one sort of overall score to give you an idea of how environmental justice looks in this area, right? And so what I want to make really clear is that these data are not intended to be used as risk exposure, right? That is very clear, and that is not the point of these indicators and these maps. But what these maps can be used for, and this is what they very explicitly say should be used for, is to firstly identify areas that can require special attention or additional resources to improve health and health equity, as well as characterizing what are those unique factors that are driving all these different things, knowing that the context of what we're talking about is very important to inform policy and decision making, which in my perspective is exactly what you all are here to do, right? So looking at that, there are some census tracts, some U.S. Census Bureau tracts that stand out to me, really specifically close to these power plants. These plants are directly adjacent to several tracts that are considered highly burdened. In my opinion, that means that necessitates special attention to these vulnerable populations that already exist there. I think because OPPD is a state, is a public entity, in my opinion, as a health equity scholar, that necessitates a government level response to address these burdens. All right. Let me tell you a little bit just about what these tracts look like. And you guys, again, might already know this because you guys are the community. You live there, you breathe there, you work and play there. Some of the higher environmental burdens in this population that are coming from toxic release inventory sites. They're coming from risk management plan sites. And then we're moving into housing, pre-1980, things like that. Some of the social vulnerability things that are playing into this include high levels of poverty, low levels of education, lower levels of health insurance, and this has implications at the race level. This is an area that has an increased level of minority status, all of these things. And the way that this is manifesting in terms of health is predominantly diabetes, poor mental health, asthma, heart disease, and cancer in particular is one of the lower ones. And so that's what also stood out to me is that cancer was addressed quite robustly in this report, but cancer is not the only thing that is going to be impacting these populations. Firstly, second of all, in terms of causality, cancer is extremely complicated. You can smoke a pack a day for your entire life and never get lung cancer. And then somebody else right next to you could never smoke a cigarette a day in their life and they do get lung cancer, right? Cancer is extremely complicated. It is extremely lagged and it's very important because it is terminal and it is scary and it is not fun. But there are many other things that are being impacted here. And again, asthma, I go back to as really standing out from other regions. Diabetes, heart disease, those things I would probably expect to see in an area that has a high health burden. Asthma stands out to me. And because of that, asthma is directly related to air pollution, So basically what I want to end on is reinforcing the idea that risk is not equally distributed. And because of that, I think that an approach thinking about these themes that is grounded in an quality framework is actually not appropriate and is not suitable. I think instead what needs to be considered is the equity side of this. And the idea that everybody has their own lived experiences, they have their own social determinants of health, and their risk is not distributed equally.
Okay. Thank you, Corey, in absentia. Our second public health expert is Dr. Lucas Henneman, Assistant Professor of Civil, Environmental, and Infrastructure Engineering at George Mason University. Dr. Henneman directs the university's Health and Air Quality Lab, where his research tracks pollution after it's emitted to where it is breathed and how it impacts the health of neighboring communities. His scholarship is focused especially on coal pollution and has shown that emissions reductions at coal power plants over the past 20 years have left the entire country healthier and increased life expectancy. So thank you, Dr. Henneman. Are we ready to go on your end?
I believe so. Can you hear me and see my slides?
All good.
Excellent. Well, thank you, Dr. DeLeo and the other organizers for the invitation to speak tonight. I think that Dr. Ruktanachi, Corey, did an excellent job sort of introducing the sort of issues that she'd identified with the analysis taken in the report. Most of my comments are going to focus on some big issues that I think are not included in the report. So moving right to it, and if the two big things I think to take away that are not in there as I see it, is first we have really substantial evidence at this point that, sorry about that, that air pollution from coal power plants is linked to poor health, early deaths, and unequal exposures between groups. And I didn't see that acknowledged in the report. And second is that we have uh, really good documentation at this point that reducing emissions from coal power plants improves health. And so those two key points, I think, are necessary for a full health risk assessment. And so I'll go through the first one first and then the second one, and you'll uh, probably hear myself and the next two speakers talk a lot about this study that we did, we published in Science, called Mortality Risk from United States Coal Electricity Generation. Sorry, it looks like my screen share is kind of funky. Let me try again. Um, okay, that looks better. And so in this slide, I just sort of give an overview of how we did that study. So we started with SO2 emissions, sulfur dioxide emissions from each of 480 coal power plants in the United States. And we said, okay, we know that these power plants exist. We need to figure out who's exposed. And so we ran air quality models to understand who's exposed to those emissions. We had data on individual level Medicare participants and knowing where they lived, when they died. And we used that data, we linked it to the exposure to estimate the mortality risk associated with coal particulate matter. And finally, we used that linkage to estimate the number of deaths associated with coal PM 2.5 over this long time period, which is a really important time period because the US reliance on coal decreased substantially during that time, and we cut emissions a lot. And so I'll talk about exposure first. In order to identify who is exposed when, we run air quality models. And so these models consider both the emissions, the transport. So you can see the transport on the left side. I'm from Atlanta, Georgia. This is a big power plant near Atlanta, Georgia. Looking at how once the pollution is emitted from that stack, it really travels all over the eastern U.S. And along with where it's going, it's transforming in the atmosphere and turning from a gas into particles, and those particles end up in the air we breathe. And so this idea that the pollution is emitted locally, but it impacts, broad regions is really important for understanding the full health impacts of these facilities. And if we look at sort of like a broad time period, for example, over a whole year, this is a different facility in Indiana. You end up with this large exposure pattern where most of the country is exposed from the emissions from this facility. And so in doing this study, once we linked the exposure to the Medicare population, we ended up with a number, a relative risk of mortality per increase in exposure. And so this number in itself is sort of difficult to interpret, but we can put it next to existing estimates of, say, what the EPA uses to set standards. And our results are risk specific to coal PM 2.5 ended up at 2.6 times the risk of exposure to total PM 2.5. And this was sort of surprising to us. So evidence that coal PM 2.5 in particular is bad for health. We've studied other outcomes too. So one is preterm births, looking at births across the entire United States at different levels of exposure on the x-axis, and then your likelihood of preterm birth on the y-axis. So we looked at the association between coal PM 2.5 and preterm births. And what we found was that increasing coal PM 2.5 was associated with increasing preterm birth levels, even at low levels in this, at low concentrations. And this even greater slope at lower concentrations suggests that removal of remaining coal power plants may offer greater benefit per unit reduction. And finally, on sort of the evidence that we've created of health impacts or environmental justice impacts of coal, the evidence for that, we linked that same data set of exposure from the 480 US coal-fired power plants to population data across the United States. Now, the exposure to coal PM 2.5 decreased by about 95% over 22 years from 1999 to 2020. And at the beginning, the black populations, especially in the North Central, and that included Nebraska, were exposed to more coal PM 2.5 compared to other populations. Now, even with this 95% decrease over that period, facilities in Nebraska continued to inequitably expose black populations. That was a specific finding of our paper. Now, so that's part one, is that we know coal is bad for health and is inequitably distributed. The second point that I want to make is that we've documented that actually reducing emissions from coal improves health. And so there's an opportunity here with the existing coal power plant. So back to the science study, if we look at total deaths over the entire study from 1999 to 2020, it was almost 500,000 deaths in the Medicare population. But there's a real success story here, is that in the early years, so 1999, 2006, the average was about 43,000 deaths per year nationwide. But in the later years, going until 2020, it was more than an order of magnitude decrease. So only 1,600 deaths in 2020. I say only, it's still likely too many. And one of the things we were able to do in this study, because we looked at specific coal power plant impacts, is we were able to pull out the mortality, the death associated with specific coal power plants. And this is from an online tool that we made. You can follow the QR code. I will admit the mobile version is not that easy to use, but if you can scan the QR code and then use it on your computer, you can enter in the Omaha facility here and see how the deaths contributed or that we associate with emissions from the North Omaha Station decreased over time or changed over time, and especially since the 3 units converted to natural gas, you see this drop off. The other thing you can take away from this is that these impacts are certainly not only local to Nebraska. So this is the number of deaths in each state associated with that facility, and actually it's not even Nebraska ranked number 1, because you both have where the pollution starts, but where it goes and who lives there. And this facility happens to influence large population centers in Illinois, for example. Two more just pieces of evidence for improved health with decreased coal emissions. This was a study in Louisville, Kentucky. Around 2015, there were a series of sort of major emissions reductions. And since we had the model to look at exposure associated with those reductions, including one at Cane Run, which is about the same size as North Omaha Station, once those facilities installed scrubbers, shut down, we observed this really steep drop-off in asthma hospitalizations and emergency room visits, along with we had data on individual level asthma medication use and found that there was an association there as well. Finally, in Atlanta, Georgia, we looked at the asthma emergency department visits prevented by specific policies. So there's a lot going on here, but this power plant policies implemented between 2000 and 2012 avoided about 15% of asthma ED visits as what would have happened without the emissions reductions policies on power plants. So again, evidence that reducing emissions improves health. And I'll end here with my two take-home messages again. Without including the evidence that coal power plants are linked specifically to health, without evidence that the research has documented that reducing emissions from coal improves health, this is, in my opinion, not a full human health risk assessment. So thank you, and looking forward to hearing questions and from the other panelists.
Thank you, Lucas. Our third public health expert is Dr. Corin Ziegler, professor and director of biostatistics at Brown University School of Public Health. Dr. Ziegler's expertise and statistical research focus on quantitative methodology for evaluating the health impacts of environmental and climate-related exposures. His work integrates statistical methodology, epidemiology, large-scale computation, and atmospheric science towards better understandings of how environmental and climate policies impact human health. Dr. Ziegler's research has been funded by the National Institutes of Health, the Health Effects Institute, and the U.S. Environmental Protection Agency. He's served on multiple specialty panels for the U.S. EPA Clean Air Scientific Advisory Committee, so we're particularly interested for his expertise in terms of how reference to EPA thresholds are being used in the discussion around North Omaha Station. Are you ready to go, Corwin?
Yes. Can everybody hear me and see my slides okay? Okay, great. Thanks. Well, thank you for the introduction, and thank you for the chance to share some of my thoughts with this group. I have been working on research to characterize the health impacts of pollution from coal power plants for the better part of the last decade. And I'd like to give some thoughts on my read of this report produced by EPRI, and I'll try and put a finer point on some of the things that have been raised really by all of the previous speakers. And because I know we're a little short on time here, I may try and forgive me for skipping around if I feel like I'm going to completely reiterate something that we've already heard from another speaker. So in my opinion, in my review of this EPRI report on the risk assessment for North Omaha Station, I think my main takeaways are that I do not believe that this report represents a full-scale human health risk assessment. Part of the reason for that is I worry that this report misinterprets EPA air quality standards, and I don't believe that the information in the report can adequately support decision-making that incorporates environmental justice considerations. And for me, the bottom line, and I think this echoes what the previous speakers have said, is that the scientific evidence is clear that keeping coal units in operation will harm more people than if those units were retired or converted to, say, natural gas. So I'll try and elaborate that on a little bit. So I'd say the main reason that I don't view this report as a full-scale human health assessment really follows on what, especially what Dr. Henneman just said, is that I think the report omits or mostly omits what the major avenue to health impact is for pollution from North Omaha Station. And so the reason I think that is because of the way the report considers really all of the criteria air pollutants, but I'll focus my comments on particulate air pollution, which we've already heard about. So we basically know for sure that coal power plants are major contributors to particulate air pollution. And that's because, as Dr. Henneman said, sometimes they literally spew particles from their smokestacks. But that's not actually the main part of the problem here. I don't think the main part of the problem is what are called precursor emissions, where burning coal emits some other things that are not particles, but they later become particles in the atmosphere. And I think that's really the major part of the story here when it comes to health impact in terms of who's exposed and who breathes these particles and what makes people sick. And I think that's largely omitted from this EPRI report. So we know that coal power plants are major contributors to particulate air pollution. We also know, or at least there's a scientific consensus, that this type of particulate air pollution causally and adversely impacts health outcomes. And that's not my own personal opinion. That's the language that's used as concluded by the EPA during their process for setting air quality standards. And so I want to continue to refer to that process that the EPA goes through for setting their air quality standards. And part of that process is they produce these documents that are pictured here on the screen, which are called integrated science assessments. These are production of these documents is a major scientific undertaking that integrates and synthesizes evidence from all over different literature, scientific literatures, to learn about how, in this case, particulate pollution may impact health and welfare. And so I've got the pictures of their covers, and also check out those page counts. This is a serious undertaking in terms of how much information is synthesized in these integrated science assessments. And one of the outputs of these ISAs, which, as I said, I'll continue to refer to, is something called these causality determinations, which is in this case, the ISA for particulate matter concludes that particulate pollution is causally related to many different health endpoints. Here's just a summary table pulled directly from that report, where we see the types of things that have been referred to: respiratory health impacts, cardiovascular, nervous system cancer, and even all-cause mortality that are determined by the entire weight of the evidence to exhibit a causal, or likely to exhibit a causal relationship between this type of pollution that we know coal power plants contribute to and these types of health endpoints. And so I think this is the type of evidence synthesis that I think is largely omitted from the EPRI report. And I think that it's that type of omission that sort of omits things that we know about power plants that, again, just to echo something that Dr. Henneman already said, these are results from a study that we worked on together. It's the exact same picture that we just saw a few minutes ago. And as was previously alluded to, but I want to highlight again, this line chart on the right is tracking deaths attributable to coal, the North Omaha Station power plant over time. And we see a detectable drop when those first 3 units were converted to natural gas in 2016 and 2017. And those are the types of impacts of reducing emissions from coal power plants that I don't think are captured in the types of analyses done in the reports. And we've seen it happen before, even at this North Omaha Station when the previous units were converted to natural gas. The next point I want to make is just a couple of comments on why I believe the EPRI report misinterprets EPA air quality standards. And the basic point I want to get across is saying that an area is in attainment of EPA air quality standards is not the same thing as saying there's an absence of health impact of air pollution. And so I want to elaborate that on a little bit. The National Ambient Air Quality Standards are one of the main ways that the federal government regulates air pollution in the United States. They are designed to protect public health within an adequate margin of safety. These are not limits on what individual sources like North Omaha Station should be allowed to emit. That is not what these National Ambient Air Quality Standards are for. And the process that sets these standards recognizes explicitly that there's evidence of health impacts of pollution that persist below the levels of the National Ambient Air Quality Standard. And so I think there are certain statements made in the EPRI report that, in my opinion, do not support the conclusion that there are no significant health impacts from units 4 and 5 of North Omaha Station. So I have a couple example statements there from the EPI fact sheet that I think represent a mischaracterization of EPA thresholds in this context. So this is acknowledged explicitly in that integrated science assessment I referenced previously. So part of the information that goes in the decision-making for federal regulatory decision-making acknowledges that there's evidence of a no threshold relationship between pollution and health. This is a quote from that integrated science assessment that explicitly acknowledges that the ISA, the integrated science assessment, evaluates studies that provide evidence of a linear no threshold relationship between PM 2.5 exposure and respiratory cardiovascular effects and mortality. So even though the EPA sets these standards, these air quality standards, the science used to inform those standards explicitly acknowledges that there's evidence of a no safe threshold when it comes to exposure to this type of air pollution. So finally, I believe that the report, the EPRI report, cannot adequately support decision making that incorporates environmental justice considerations. As has been alluded to repeatedly, I don't think the report carefully enough evaluates the inequitable burden among either at-risk or susceptible environmental justice communities. We've heard about who might live nearby this power plant and what they might be sick with already. So I won't belabor this point, but serious environmental justice considerations have to take careful account of exactly which communities are being exposed, what the health burden is of that community from historic exposure to North Omaha Station or other sources of air pollution. And the bottom line here, the last bullet point, is that a report like this, in order to inform, would have to incorporate what's known about incorporate that what is known about the general population may not uncover serious environmental justice implications, and I don't believe the EPRI report does that. And then this is just to say that within the context of regulatory decision making, in the particular matter integrated science assessment that EPA uses, it also determines that the evidence was suggestive that people of low socioeconomic status, and it was adequate to indicate that race and ethnicity, specifically non-white and Black populations, are at increased risk of PM 2.5 related health effects, in part due to disparities in exposure. So when it comes to setting national air quality standards, this is known, this is acknowledged, there's scientific evidence to support this, and I don't think these types of considerations appear in the report on the risk assessment for North Omaha Station. So I'll just stop here to reiterate my summary. My opinion is that the report does not represent a full-scale human health risk assessment, in large part because of its under consideration of secondary particulate matter pollution. I do think that there are statements in the report that misinterpret EPA air quality standards, and I don't see how the report can adequately support decision-making that incorporates environmental justice considerations. The scientific evidence is clear that keeping coal units in operation will harm more people than if those units were retired or converted to another fuel source. Thanks.
Thank you, Dr. Ziegler. Our final public health expert is Dr. Francesca Domenici. Dr. Domenici serves as the Clarence James Gamble Professor of Biostatistics, Population, and Data Science at Harvard's T.H. Chan School of Public Health, as well as the Director of Harvard's Data Science Initiative and faculty affiliate in Harvard's Department of Environmental Health. In 2024, she was named Time 100 Health as one of the most influential scientists in global health in the world. Dr. Domenici is the founder and lead principal investigator for the National Studies on Air Pollution and Health Group, and has published extensively on air pollution and health. I believe she may have also invited some of her research team members to join her today. So are you ready to go, Francesca?
Yes. Can you hear me?
All good. Thank you.
Great. Okay. Thank you. It's a privilege to address you all. Also, I think I also want to acknowledge 3 PhD students in the team. I'm going to show you some preliminary additional analysis that we have done, and I wanted to acknowledge them and their help in putting this presentation together, and some additional analysis. They have done it on their free time and really for the interest of public good. So I'm going to skip on the background and context. I think that you're pretty much aware in all of the slides that has been presented before, and I'm gonna basically share my presentation and divide my presentation in 2 parts. One are our criticism of the EPRI report, which are fully consistent with the the presentation of the three experts before me, and I'm going to be pretty quickly because there is no point of repeating the same thing. And I also wanted to emphasize that the conclusion came from the four of us in a very independent way. So we didn't coordinate the message. But basically, these slides are the conclusion of the April report, and I'm going to go very quickly on my criticism of the April report. Again, fully consistent with the three panelists before me. And so I'm just going to run it through pretty quickly. And then, although I want to show you what a full public health assessment should look like for the North Omaha Station in a way that will be fully consistent with the peer review science. So in terms of the critique of the April report, as my colleague Dr. Ziegler mentioned and Dr. Henneman mentioned, clearly they ignore the major driver of the adverse health impact, which is PM 2.5 and ozone. And so not only they ignore that, but they also ignore, as Dr. Henneman mentioned, the adverse health impact from coal-fired power plant and coal PM, which, as was reported in Lucas Henneman lead author paper in Science, is even more harmful than total PM 2.5. So I just want to reread the last point. These two pollutants together account for nearly all of the serious health impacts of outdoor air pollution, yet the April report does not model them, does not estimate their health impact, and does not evaluate how much the coal unit contribute to them. I also wanted to very briefly mention that when we talked about, we reported in Science or we reported in peer-reviewed literature, if there are people in the audience that are not familiar with how science is done, I wanted to point it out that some of the statements that myself and my colleague are making are not our own personal opinion, but are a result of studies that took years to complete and were peer-reviewed. That means they went to the scrutiny of other experts that in an unbiased fashion assesses whether or not these analyses were right. So we have zero conflict of interest in all our statement, but also everything we say in this presentation is not our personal opinion, is what we have discovered after years of rigorous studies that were approved and peer-reviewed by colleagues. Then very quickly, as Corey, my colleague Dr. Ziegler mentioned, the April report wrongly assumed that below the threshold there is no health impact, and then in attainment means no health impact. That is just flat wrong. It's very well acknowledged in the community, and again has been reported extensively in peer-reviewed science, including the New England Journal of Medicine, which is the medical journal with the largest impact factor in the world. So that is wrong. As also mentioned, it's really serious that they did not consider the environmental injustice assessment. And again, based on peer-reviewed science, it's very well known that cleaning the air and reducing pollution in the air, reducing coal pollution in the air will benefit people of low income and Black American more than the general population. And so again, I'm just showing a screenshot of another peer-reviewed paper that provide the evidence that more stringent national ambient air quality standard will more overwhelming reduce the number of deaths among the more vulnerable population. This has been also extensively reported in the media, including the New York Times. And finally, and that's where I'm going to transition to the second part of the analysis, and this is something that has been not touched directly by my colleagues, is the fact that this April study does not inform policy decision. It doesn't tell you how beneficial it will be or how damaging it will be if this phasing down of coal-fired power plant will not occur. So they never compare it to realistic alternative, like, for example, what was promised to you on reducing coal use, switching fuels, or retiring the coal unit. And so because it doesn't compare option, it basically, the only thing it does is say, don't worry, the status quo is fine. Consequentially, the report cannot show the community the health benefits or harms associated with different choices. And so it doesn't empower you to negotiate and say, well, how about we do this instead? So without this information, residents and decision makers are left without the facts they need to understand for understanding the real trade-off and make an informed decision about the plant future. So that's what we have attempted to do. So we have done an analysis, which, full disclosure, will be completed soon and it will be going in peer review. And so that's what we did. We leveraged and build on the fantastic study of Dr. Henneman that looks at the adverse health impact of coal pollution. And so basically we started with the estimated relative risk that was already accepted by the peer review literature. And so basically we started by taking the estimated number of deaths that we would expect to see for 1 unit of increase in coal pollution that was published by Dr. Henneman. But then we considered 3 future scenarios. One, that you will have a coal-free future, right? All 5 units are shut down, zero emission for the period 2026 to 2030. Second scenario, it's your current status. 3 units are run on natural gas and 2 units will still burn coal from 2026 to 2030. And then your third scenario, which is more coal like 2019, 2022, which is the same as the scenario 2, but with more coal use, similar to the average coal generation in 2019, 2022. I wanted to emphasize that these third scenarios is conservative because we do know by doing extensive research now on the environmental and health impact of data center, we do know that the amount of energy demand from this data center tends to be pretty massive, but we want to be conservative. So we consider 3 scenarios for you. No coal, keep it as it is right now, and more coal, which is what unfortunately, I'm worried that you might be facing. And then we measure the real health impact under these 3 scenarios using methodology that is exactly the same as the one of Dr. Henneman in the science paper. And so instead of saying, okay, don't worry, but if the level of pollution is below the regulatory limit, you're fine, we actually estimate how many illnesses and deaths are actually expected in North Omaha under each scenario. So then you are aware and can see the real health trade-off of continued burning coal. So this is just a graph that shows what were the level of CO2, NOx, and SO2 over time under the scenario where, as you can see, was in 2015 and 2016, and then you have 3 units that were converted to gas, and you see that the emission immediately start decreasing and further decrease after 2022. So this is our analysis. So again, using exactly the same methodology from the peer review literature. So the first one, ideally, you have a 0 emission. So if there is a full coal phase out, clearly there are 0 extra adverse health impact. The second scenario, which is the second column, it tells you the current pattern as we expected to see in terms of premature death, emergency room visit, cardiac disease, neurological disease, loss of school days and loss of work days. And then you see on the last column in some circumstances, more of the double of this adverse health impact that will occur under more heavy coal operation. So I want to spend a little bit of time on the conclusion. So first of all, consistently with the other panelists, the EPRI report does not provide a scientifically valid assessment of health risk as embraced by the full research community. It ignores decades of peer-reviewed evidence showing that PM2.5 from coal and also total PM2.5 causes serious health harms even at level below federal standards, and that marginalized community face greater impacts. By leaving out PM2.5 and ozone and differences in community vulnerability, the report cannot meaningfully speak to the actual health risk facing North Omaha. The second point, I think this is a new point, but I'm confident that my colleague will embrace, is that we do feel as a scientist with zero conflict of interest that it's extremely important that independent and neutral data-driven analysis is essential for decisions affecting community health and environment. As coal plants and new hyperscaler data center infrastructure shape the future of energy in this region, the community, that means you, deserves evaluation done by independent experts, not organizations with industry ties, and they rely on transparent, peer-reviewed science that can be independently checked. The community finally deserves clear estimates of impacts under realistic future scenarios. And so residents and decision makers should be shown how different choices, coal retirement, fuel switching, increasing electricity demand from new data center would affect the air they breathe, their health outcome, their household energy cost, and environmental impact. Without this, the community cannot make informed decisions about its future. Again, I'm really grateful for the opportunity and looking forward to address any questions.
Well, thank you so much, Dr. Domenici, that you and your team went and did that additional analysis, went far beyond our hopes and expectations. Everyone, please join me in thanking our health panelists again. So in order to introduce our final panelists and some context on reliability, I'm going to hand the mic over to Liz Veazey. Liz has 25 years of experience in energy policy as a volunteer, board member, and organizer, and co-founder of nonprofits. Currently, she works as director of state policy campaigns at Solar United Neighbors. So thanks, Liz.
Right. Thanks, Ryan. That is a hard show to follow. They really knocked it out of the park there, I think. All right. So, we know that redlined community, the redline community here that's hardest hit by pollution also struggles with high energy bills and energy burdens. We know that other options to support voltage to reduce peak demand and ensure reliability could lower those energy burdens and increase resiliency. Options like energy efficiency or demand response, so like shifting loads off of our peak, distributed solar and storage. And you would expect public power to prioritize these resources, which provide benefits to us, the customer owners, and the utility overall. So I think, as many of you know, the board has voted multiple times to end coal burning in North Omaha. But OPPD staff want an extension of coal burning there indefinitely. Staff claim continuing coal is necessary to address voltage, capacity, and reliability concerns. However, I think as noted earlier, there was a September presentation this year to the board where staff presented a 2030 projected reliability of 99.99%, with projected new projects coming on. And they stated that the North Omaha Station coal retirement was on schedule. So there were no problems that we were aware of just a couple months ago. So continuing to burn coal is also really expensive economically, not just in terms of health costs. So using levelized costs for a depreciated coal plant, we can estimate that it costs around $100 million a year to keep it going at the current levels. So what else could we get with $100 million a year? What about that over 10 years? That's $1 billion. So there are also large-scale renewable energy projects, although there are often, challenges to siting those. OPPD, we know, has, had available multiple renewable energy projects, renewable energy and storage projects that were permitted, and OPPD staff only met the minimum 1 gigawatt out of a 1 to 1.5 gigawatt of renewable energy capacity goal. So there was a lot of potential renewable energy we could have brought online. The projects are there. We don't really understand why, but the staff didn't want to do them. They would apparently rather keep burning coal in North Omaha. The board in the past set a 300 megawatt demand response goal when they first voted in 2014 to end coal burning at North Omaha Station. And so demand response is like shifting load off of the peak times. So like turning your air conditioner off for 15 minutes at peak on a hot summer day. So there's a lot of potential with opportunities there. And in the 2017 resource plan, the goal was 300 megawatts of demand response by 2023. In 2024, OPPD only had 140 megawatts, so half of that, or a little bit less than half of that goal. OPPD does have some of those programs. There is a successful smart thermostat AC management program. Many of you may be a part of that and receive credits for that. But there are many other opportunities to shift load, reduce peak, increase reliability, provide credits to customer owners to reduce their bills. So OPPD, doesn't have an EV or electric vehicle charging program to manage that load and shift that, or a hot water management program to shift that load. There are only 22 commercial and 2 industrial customers enrolled in demand response. I think there's huge potential to expand that if there was interest and commitment. OPPD also only has 5 megawatts of peak reduction from energy efficiency. So there's huge potential to grow those programs, reduce peak, lower bills, no emissions from that, right? There's also distributed energy resources like rooftop solar paired with batteries. That can help lower demand, increase resiliency, lower bills. Can also help with voltage and other things. So we can incentivize, we can aggregate those resources in like a virtual power plant, and together they could provide dozens of additional megawatts. So together, some of those resources could easily replace the coal plant's 355 megawatts. And so we've got 2 expert panelists to talk more about some reliability issues and some of these things. We're really lucky to have Jigar Shah and Carl Robigo. They both have decades of experience with many of these practical, affordable alternatives to continuing to burn coal. And they'll, help suggest some additional important questions that remain unanswered. They're both internationally renowned, and I'm not going to do justice to their expertise, but I'm going to give a quick intro. First, we'll start with Jigar Shah, who is former U.S. Department of Energy Loan Programs, or LPO, director. He also has founded a renewable energy company, Sun Edison. He was a co-founder of Generate Capital finance company. He's currently with Multiplier, but he has decades of experience in the energy industry, especially with energy finance. He produced some really great reports on virtual power plants, liftoff reports at the Loan Programs Office, and I will just let him take it away from here. Thanks so much, Jigar, for joining us.
Thank you, Liz, and thanks for all of your leadership. I think we, sit at a very important point today. When I was serving at the loan programs office, we passed a new loan program called the Energy Infrastructure Reinvestment Program. It has now, of course, been renamed Energy Dominance Financing Program. But I think that um, while I was running that program, electric utilities offered up over $100 billion worth of loan requests into the program, mainly to repurpose their coal plants. And the reason that they did that is because these coal plants are very expensive to run. When a coal plant reaches end of life, and many of our coal plants have because they're over 50 years old, they cost a lot of money to maintain. And, even when they're maintained and run properly to be able to avoid a lot of the health impacts that many of the experts just went through, they generate power at far higher prices than the roughly 4.8 cents a kilowatt hour that OPPD currently pays to procure wholesale market prices. And so not only are they running dirty, as was just described, but they're running at a price that's way more expensive than the average prices that OPPD pays for. What are some of the alternatives? OPPD already has a pilot program that recommends 300 megawatts of demand response. OPPD has been piloting demand response since 2012 with thermostats and lots of other things. But what it hasn't really done is gone into the next level. Today, batteries are 90% cheaper than they were in 2012. And so those batteries actually are being deployed at scale to support the Texas grid. So the Texas grid has experienced the highest rate of load growth in the entire nation, and they have met almost all of that load growth with solar and battery storage. Not only have they met it with solar and battery storage, if you remember, the Texas grid had extraordinary brownouts during a polar vortex winter storm Uri in 2021. And since that time, if you might remember, the wholesale market prices in Texas are made to cap out at $10,000 a megawatt hour because that's how their market runs. Because of all the batteries that have been added to the Texas grid, those prices are no longer reached. In fact, the prices have been quite stable in Texas and are lower than almost every single region in the United States because of those batteries. And so one of the things I want us to stress here is that we hear a lot about baseload power. We hear a lot about all of these other terms. These are not defined terms that you study in an engineering class. These are all public relations terms that are made up just for these types of hearings. The way that the grid normally works is you have a diversity of technologies that are on that grid, whether it's coal or nuclear or natural gas or solar or wind. But what you find is that our electric utility system was built such that when you turn something on in your home, a generator has to immediately generate more power, transmit that power immediately over a transmission line and distribution line to feed your extra load. That is the most expensive way to deal with commodities. For those of you who, live in Nebraska, right? I grew up in rural Illinois. If you're familiar with farming, there's lots of storage in that process, whether it's grain elevators or refrigerated warehouses or lots of other things along the route. For those of you who grew up in the oil and gas sector, there's a lot of storage, right? Whether it's tank farms in Oklahoma or whether it's fuel tank farms for refined products like gasoline and diesel. Electricity is the only commodity supply chain in the world that doesn't feature storage, right? And now that storage is so ridiculously cheap, we need to feature storage. And that's why many of those $100 billion worth of projects that I saw from electric utility companies around the country were accelerating the retirement of their coal plants, replacing those coal plants with battery storage. Earlier this year, when the current administration went to Arizona Public Service and told them that they should leave their coal plants open, Arizona Public Service said it would be unacceptably high cost to keep those open, and they replaced those coal plants and the capacity that they provided with battery storage. And so one of the things that is very important for all of you to know is that this is the highest cost way of providing this service. And as my colleague Carl Rabigo will talk about, it's not even a good way to provide these services. To the extent that you have issues with power quality or issues with voltage or issues with other things, battery storage is a far better way of doing that than keeping a coal plant open. But the last thing I would say is to the extent that you care about resiliency, right? What happens when you have a natural gas plant or a coal plant is that they also have resiliency problems. So in Nebraska several years ago, there was a moment where you had a polar vortex and the river that the coal plant uses for cooling water had frozen, and therefore the coal plants had to shut down. And so these coal plants are also not great during a polar vortex. You know what's fantastic for a polar vortex? Batteries. And so with that, I would love to pass it back to Liz and suggest that we hear from the real expert in the room, my friend Carl Rabigo.
You're too kind. All right. Well, thank you, Jigger. What a great setup too, because as usual, we're just mind melding on, what's the problem? Why are we ignoring the solution? My name is Carl Rabigo. I work as a regulatory utility consultant. My kids still don't know what I do for a living. I'm based in Denver, Colorado. I bring to this discussion about 35 years of experience in this field, following about 13 years as an Army officer. So the first thing I wanted you to know is what's my frame of mind. My frame of mind is I'm a former municipal utility vice president at Austin Energy. So I ran a section of a public power utility focused on distributed energy services, energy efficiency and storage and electric vehicles and all those fun things. Second, I have been a public utility commissioner. So I've sat where the board is sat, but I did that in the state of Texas, one of 3 commissioners who regulated all the telephone and electric utilities. Third, I was an officer in the U.S. Army. I was an armored cavalry officer and a judge advocate. My last tour was teaching constitutional, military, and environmental law to cadets at the U.S. Military Academy. And we can talk about lawful orders and an officer's duty to disobey them in another forum. The question that I seek to address here is, has the staff made an honest, complete, and sufficient case to once again delay implementing the board's direction to stop burning coal at the North Operating Station? That's the question we would pose it if, in law school, right? From my review of the history and the facts, I conclude it has not. First, a couple of points, additional points on background. I'm new to this particular situation. I don't know everything the staff has done over the last 11 years. My opinions rely on what facts and information I've been able to review. But I bring 35 years of experience having looked at utility resource plans, and unfortunately, this kind of proposal is not that unusual. Second, I'm a committed proponent of what we call distributed energy resources, right-sized, right-sided solutions that can provide reliability, affordability, and truly clean solutions. Third, the basis for my opinions are well documented. I've literally participated in the writings of the books on distributed energy, including the National Standard Practice Manual for benefit cost analysis for distributed resources, and Small is Profitable, an award-winning definitive treatise on the benefits of distributed energy. Finally, a great deal of evidence that I've read and studied related to human-induced climate change and about other environmental impacts tells me that we do have all the kinds of problems you've heard, and it carries over to the regulatory, economic, financial side as well. Interesting to Jigger's story about the water freezing and not having the cooling systems. The year after I got out of the Army, a long time ago, I wrote the lawsuit that will end the practice of using once-through cooling of large thermal power plants because, well, it kills billions of aquatic creatures every year, but also it makes these power plants even more vulnerable to severe weather. And then finally, I've spent a lot of time doing and reviewing resource planning and deployment. And the first step is to align your planning and your deployment with the existing policy, but also meet your goals like reliability, utility customer savings. The primary reasons for my reaching the conclusion that the staff has failed to justify the adoption of this resolution are several. I'm going to focus, like the staff did, on reliability, affordability, and planning, having had the environmental and social justice issues completely addressed by the previous panel. I want to run through some specific problems. If you get a chance to review the staff presentation, this is how to read corporate utility speak or corporate speak critically, or at least a few lessons in it. Number one, rapid load growth. Liz mentioned this. Rapid load growth is cited as a problem, but it really doesn't appear to be one. The evidence is there's been a fairly manageable rate of growth in the years leading to today. The graph with the big increases on the right-hand side of the chart actually jumps forward 5 years. So it's a little misleading in how the data is being portrayed. And if you average that out and smooth that out and rightfully assume that all the increase for 5 years isn't going to happen in the very first year after the NOS closes, then what you see is a manageable level of load growth that can be managed with other better resources. In fact, when I was a utility executive, I had specifically that job. I was given an assignment by our city council, the equivalent of the OPPD board, to build a conservation power plant, 770 megawatts in size. I know because I got bigger results in a bigger utility, but I know that the staff could have eliminated the need for the North Operating Station by just doing about 50 megawatts a year of efficiency and other distributed resources. Then they wouldn't need it anymore. And with resource options like that, you get fringe benefits. Fun fact that I still love to tell, when I was at Austin Energy, because of our strong push for energy efficiency, the average residential bill in Austin was 20% lower than the average residential bill in Texas. We were properly described. Perhaps Omaha's a little like this, but we were a blueberry in a really big bowl of tomato soup. But we also saved our customers money. Second, weather extremes are cited as a problem. Let's put aside the irony that climate change is what makes weather events more severe and that fossil fuels emissions are what causes that. But it is important to note that severe weather causes large fossil units and the transmission they depend on to fail and fail bigly. Blackouts and other places cited in the presentation from the staff are features of this kind of event, and the sort of the collapse of the central station dominated grid, something we call the domino effect. Third, they cite the grid alerts and voltage problems. If you have voltage problems on a distribution grid, you don't address them from the top down, and Jigger pointed in this direction rightly. You address them from the bottom up with modular local resources, solar, virtual power plants, flexible and controllable load, conservation, and efficiency. And if you're not doing enough to control those problems, you do more of those resources and get to the places where they need to go. Fourth, staff cites the North Operating Station as a significant tool in solving the problems ahead of them. But when you have a sledgehammer, you pound everything like it's a railroad spike. The NOS is not the right tool. The distributed resources are a more elegant solution, especially when supported by smart meter systems and DERMS. Here's your geeky regulatory acronym for the evening: Distributed Energy Resource Management Systems. The staff has started on those, but they need to accelerate that work and make sure it's useful in addressing this problem. The mega grid that you all sit in, the SPP as it's called, does appear to have some transmission issues. There's some really pretty graphs in there showing a north-south problem. That's a transmission problem. Accelerating and targeting transmission improvements would provide better access to purchase power resources to replace the station. The staff has some of those, the district has some of those underway. They could be accelerated as well. And then finally, there are the staff points to alleged savings from delaying conversion of the North Operating Station. The problem is they're unsubstantiated, and as you heard from the scientific analysis of like the EPRI report, they don't even consider the alternatives, the sensitivities. There's no evidence that they looked at anything else. If that's not the best deal, it's not what the board should approve for the people of OPPD. So Bottom line on that one, in God, you can trust, especially at Crate. But everywhere else, and especially utilities, you need to bring data to support your recommendations. Okay, so here's my wrap up of the points that and how you would do this. Well, not a wrap up, but is I'm going to walk through these things with some key points. First of all, the November slide deck is not a resource plan or even an analysis. What it looks like is a PR set of talking points that is fine because you need to explain what you're doing to the public, but that kind of thing comes after you've done the full, transparent, and honest analysis. Second, the goal the board set, the order that was handed down was completely achievable. A diligent staff with motivations aligned with policy would have been able to meet this. And there's a point at which you stop giving extensions on your homework assignment or any other important job that you have to do, and you hold people accountable. They haven't justified, as I already said, they haven't justified this extension. It's not time to surrender. You haven't even tried the mission yet. So 11 years ago, the board said, let's get this thing out of the coal business, and it should remain the case. Third, no discussion of all those alternatives to this drastic proposal. Simply no discussion of those alternatives. If you want to see a place where the alternatives are discussed, look at the resolution the district passed in 2014 when it decided that NOS had to change. Fourth, this kind of recommendation should have been supported with a full resource plan. Interestingly, the staff is saying they're going to start their integrated resource plan next year. Well, that's too late to inform the decision they want the board to take today. This date was set. They could have accelerated the planning process. They could have considered clean local generation, efficiency, demand response, storage, and other resources like Liz listed for you. They didn't. Replacement power is coming on fast. They had a power plant for 220 megawatts called Turtle Creek. It was scheduled to come online in 2029. It came on this week. And a third turbine is going to come on in 2027. Fast start gas power plants that meet at least half the need that the NOS station would lose while it converts to gas as the board directed. So there's other opportunities to accelerate planned resources. Those should be taken. Sixth, political sound bites do not substitute for good energy planning. There is noise in the current political climate, but it doesn't justify the continued operation of the obsolete and uneconomic generation. Rational decision making at a utility organization that serves the public interest has to look beyond the noise and do what's best for the public interest. Seventh, the alleged problems cited by the staff can be addressed without delaying the closure. I've already laid out a lot of that, so I'm just going to keep moving ahead. Next, as recently as a few months ago, Liz mentioned this, there were no reliability problems associated with the current plan. Also, somebody else mentioned it earlier on. Suddenly, there are reliability problems. Reliability problems are foreseeable unless they're caused by those sudden, severe, and unpredictable weather events, which you, by the way, you can predict we will keep getting. So we need to be ready for them. But 2 months ago, 4 nines, now there's not a problem. There's a problem that needs explaining. New data center load has already been mentioned, but in the staff presentation, it's the unnamed elephant in the room. And there are solutions for that. New data centers, even if they actually happen, there's a lot of phantom load out there, can be more efficient and can operate with on-site resources and flexibility capabilities. They're not going to get built overnight, even if they appear at all. And there's a whole lot of people in this area that I talk with regularly who say the bubble is going to burst. That means not everybody's going to get the data centers they're trying to court. Delaying NOS shutdown to court a potential data center without expecting the data center to do their share misses the mark. and is irresponsible. And not only that, it ignores the fact that these data companies, Google, Meta, they all still have ESG corporate objectives. They want clean, carbon-free electricity, not more coal. Finally, grid alerts and voltage fluctuations should be met with resources best suited. Use the right tool for the job. So in the end, invoking my long ago military history, the question is not whether the staff disobeyed a lawful order. That might be fun to poke at, but that's not the question in front of it. And that's how actually makes the board's decision easier. The actual question, like I said, is whether the staff has offered an alternative resource plan that justifies a change in long-standing board policy. They didn't. The resolution shouldn't pass. Thanks for your attention and for a chance to be part of this discussion. I'm looking forward to questions.
Well, thank you. Thank you to all of you for joining us tonight. Thank you especially to our extraordinary panelists. I leaned over to Ryan and said this exceeded even my wildest expectations. So what we're going to do now is transition into the Q&A portion of our event. I'll explain how we're going to facilitate that in a moment. Jay Leiter, who is Associate Professor of Communication Studies, is going to be passing out note cards to folks in the room. If you have a question in the room, we're going to ask either that you write your question down and we'll collect the cards and try and synthesize topics so that we maximize the time with our extraordinary experts. Jay's also going to be walking with the microphone, so if you would like to ask a question in person, you may do so. We ask that folks who live, work, pray, play in North Omaha be given the opportunity to ask questions first in the room. For those of you online, if you have a question, please input it into the Q&A space, not into the chat, but into the Q&A. We'll be monitoring that, and we'll also aggregate questions. As Jay is passing that out, I want to summarize where we've been tonight to bring it back to ethics. As we began tonight thinking about environmental justice in both theology and in philosophy, prudence, from Thomas Aquinas back to Aristotle, means making decisions with the best available information and with particular attention to justice. Fairness as both equality and equity that protects rights by promoting the common good with special concern for the poor and marginalized. Our public health experts here tonight indicated that OPPD's new study is not a full-scale human health risk assessment that meets evidence-based criteria for incorporating environmental justice. They also suggested that the study does not meet EPA standards for risk and cannot, as its authors claim, quote, support informed decision-making by OPPD, its regulators, and the public, end quote. Stated positively, they stress that taking coal out of North Omaha will likely benefit public health, especially among vulnerable populations. Our reliability experts signaled that it is practical for OPPD to take coal out of North Omaha, that dependability doesn't require continuing to pollute vulnerable communities. Stated positively, there are other options to safeguard reliability that haven't been discussed. So we hope that tonight's event has provided new information to help you discern whether you think it is prudent for OPPD's Board of Directors to maintain the current directive and keep their promise to take coal out of North Omaha. And with that, I will turn things over to Dr. Leiter to facilitate the Q&A.
I'll just add one real quick point. You use the word prudent, and I will tell you, if anybody ever was an aspiring utility geek, prudence is the legal standard across the country and around the world for utility investment and resource decisions. So there's a really nice fit here, focusing on prudence. So sorry, just wanted to add that.
Greetings, everybody. My name is Jay Leiter. I'm in faculty in the Department of Communication Studies, and I direct the Sustainability Studies program. We have about 22 minutes. My job is simply to direct traffic for a few minutes, and so I'm going to have some folks looking for online chats. You can use the cards, but I am going to circulate with the microphone. And again, I want to privilege particularly folks who live in the area being spoken about. Before I do that, can we just give a quick round of applause to our folks who put this together, including Dr. DeLeo, Dr. Wishart, Liz, folks online? Good. a gentleman in the back here has a question. While I move back there, I'm going to start with one thing. This was for Jigger and Carl, but Jigger went to bed. I think you saw that online. Distributed capacity procurement, distributed energy resources, and virtual power plants all seem like viable solutions to maintain reliability and refuel North Omaha on the current timeline. What do you think are the benefits of these modes of generation or modes of capacity? So I'm going to give that to Carl while I move to the back, and I'll.
Sure. So I'm lucky I have experience with this. When I was in Austin, I had a little radio control to 75% of the residential air conditioner thermostats in the city. It was amazing. I could pull down 25 megawatts of demand on a long-term basis by just cycling everybody 20 minutes. Most people didn't notice it. Or I could pull 100 megawatts instantly by pulling them all down. Our customers loved participating in the program. They wanted the clean air. They wanted to be a part of solving the problem, whether rich, poor, where in apartments or in single family homes. They were eager to sign up. That's how we got 75% of them signed up. And here's a twisted little story from a guy who was a utility person, just to round it out. I was at my mom's house, and I came into the house and I said, "Mom, it's freezing in here." We were having lunch. And she said, "Yes, you're going to turn off my air conditioner this afternoon. And I know it's going to get hot in here." And I'm like, "Mom, you keep the house like a crypt anyway. It's not going to get hot." But I went back and I realized that we were selling just as much electricity if we told people we were going to do it, because they would pre-cool their houses. It matched up perfectly with the solar energy that I was trying to encourage. It would also match up perfectly with the storage program. It saved us millions of dollars a year by avoiding peak prices, which were driven by transmission. And that's the rest of the point. There are unintended benefits and even multiplier benefits. More savings are cheaper than fewer savings if you integrate these solutions. You can do the same thing by integrating batteries. You can do the same thing by integrating rooftop or community solar. It is the great untapped resource of utility management.
Question here from the audience, and one of the things that we want to mention about how, since we are short on time, we have a QR code that Dr. Leo is going to pull up here. We are interested in questions for these expert panelists, including from policymakers who might be in the audience. If you are looking to make comments, let's do that through the QR code directly to OPPD. But for now, we're going to just take these questions. Go ahead.
Thank you, Professor Anthony. Yes, I would do my best. This question was for Dr. Dominici, but I don't think she's there anymore. Is that right?
I'm here.
Oh, thank you, Dr. Dominici.
At the last minute, yes.
Oh, okay, there you are, Professor. Thank you. You prepared a landmark report in 2020 connecting comorbid morbidity to Black communities and communities that live near coal-fired power plants. Here in North Omaha, there was a higher incidence of Black death during the height of the pandemic. I'm wondering if it's fair to infer that those deaths were directly or at least indirectly attributable to exposure to North Omaha coal-fired power plant. And if that power plant is allowed to continue to run, would you assert that if there is another pandemic that attacks the respiratory system, that these populations would also be at disproportionate risk for more morbidity? Thank you so much for the report, by the way. It was very instrumental for the environmental justice community.
Thank you. That's wonderful. I mean, so I think that we need to clarify a few things. So there are a couple of things that we know that, we know means has been very well accepted and very well documented. So during the pandemic, we know that Black community had a disproportional higher number of COVID deaths respect to the average population. We also know that exposure to fine particulate matter increase the risk of death among COVID patients. And we know that the exposure to fine particulate matter among Black Americans tends to be higher than the average. So this goes back to many of the points we have made that North Omaha, it's a very vulnerable community. It's a vulnerable community because of the historical redlining. It's a vulnerable community because of in some situations, lower socioeconomic status, lack of access of health care, and yes, potentially having even more burden because of the pandemic. So putting all of these things together, that's why we are stressing, as a public health expert, we are expressing that the community that you're living in is probably one of the last community on all the United States of America that need extra coal. Now, having said all of this, we will need to do additional study to potentially assess what is the percentage of deaths among the Black American population that will be directly attributable to coal pollution, especially in the context of a pandemic. So, bottom line is, I agree with you. I think that there is a series of concomitant factors that put your community even at higher risk. And therefore, that's why we feel pretty strongly in a line that the last thing you need is more coal pollution.
I'm just going to follow up, staying with you. There's one slide, or there's one question that I think is related. So this one says, I live a few blocks from the coal plant. Some of the slides indicated coal pollution travels long distances, and North Omaha coal plant causes harm to the states well to the east of us. To what extent does the North Omaha Station cause pollution that settles within 1 to 2 miles of the plant? To what extent do most pollution travel a great distance, and what kind of pollution settles locally? I think our first speaker that was recorded spoke to these ideas, but maybe you could just give us a little bit more on that direct question.
I think actually, yeah, I will. I will turn to Dr. Henneman, that he's the expert on air transport.
Yeah, great question. From what we know about generally where exposure happens relative to emissions happens, is that it's highest in areas closest to the source. I'll caveat, there's always sort of local factors at play, like how high the stack is, atmospheric conditions in the area of North Omaha. I'd say the modeling that we did isn't set up to answer that specific question. What's the gradient of exposure close to the source, within a mile, 2 miles? But there are models that could be done, pretty quickly off the shelf to answer that exact question. And so it wouldn't be that much of a stretch to make those calculations and estimate how exposure changes as you move further away from the facility.
Appreciate it. This is an online question, transcribed by Dr. DeLeo. Best way for citizens to challenge OPPD's lack of evidence for its position. So this is a lot of the conclusions that you drew about the analysis of the report. What do you think the best way for citizens would be to pick it up from here and challenge the lack of evidence in that report? I will leave it open. We haven't, I can't really see the screen. So
the board has a fiduciary responsibility to the people of, who are served by OPPD, right, by the utility. So they also have a fiduciary responsibility to make sure that their judgments and their policies are based on sound and substantial evidence. That is the only way you can make a prudent decision. They had sound and substantial evidence in 2014 when they first adopted this, and they decided later on to delay the resolution to transition units 4 and 5. But the staff has not provided the board with the information they need to execute their fiduciary responsibility. So, as it stands, they don't have good reason to change their policy, and their policy should stand. The staff has said they're going to do an integrated resource plan next year. They could have, if they thought that plan was going to show something different, they should have accelerated their timeline. I'm not saying that they didn't want to have a public planning process before they proposed their resolution, but they didn't have a public planning process and, stakeholder informed and comprehensive planning process before they proposed their solution. So given that all the other alternatives haven't been examined, given that there's not evidence in one slide deck, it is time for the effects of the original resolution to take hold, because the board should make a decision based on good, substantial, competent evidence. So, it's just they didn't give you enough. So don't make decisions based on this little bit of information. That's what you tell them. I don't even, if the staff were doing the honorable thing, they should just withdraw it. But they could get a negative vote on the resolution, which would be just as good.
Just a time check. We still have some time, so questions online will still be answered. Ryan's going to do a summary in a second, but we have someone in the audience first.
I'm a North Omaha resident, and I just wanted to encourage all of you that want to give your input to come out to a town hall tomorrow night with a board member, Craig Moody, who's a key decision maker in this question. It's tomorrow night from 6:30 to 8 at the Catalyst, which is 4601 Catalyst Court, near the Med Center, just off Saddle Creek. So he's looking for community input, wants to hear your voice, wants to communicate his thoughts to you, and so that's a great place to give your input.
That's exactly how a board member should, address this situation. Engage with the people who are going to have to breathe this air.
All right, thanks. We got two questions for the health folks that are pretty similar. One mentions cuts happening to the NIH and what's happening with ongoing research related to energy options. The other is similarly asking sort of what kinds of ongoing data collection are occurring that are going to help us monitor these things into the future.
Well, let me start by saying it's not good. I think that, it's actually pretty terrible. It's not a secret that some of the research that we are doing in the context of assessing the environmental health impact of to quantifying the adverse health impact of air pollution, but also a focus on justice, diversity, environmental justice has been openly targeted by the current administration as work that does not get funded. So our ability to do research has been severely compromised by the decision of the current administration. I mean, both Harvard and my colleagues, many of us lost our research grant and the federal funds to conduct this type of research. On top of that, what has been happening with the current administration, there has been a intentional effort to limit our ability to access government data, and that means monitor the level of pollution in the air, sites that, for example, quantifying environmental injustice, quantification. And so we, not only we have been stripped by federal funding, but we're also being stripped by government collected data that should be used by the researcher to advance public good and public health. So it has been probably one, actually I cannot say probably, I can say for myself with certainty, last year has been the most devastating year for public health research and for the research that we do. But we continue doing it even with limited resources because we believe what we do. And I think that this type of work that we do for your own community, for simply providing evidence, is another manifestation that we do really believe in our science and really doing this in totally non-partisan issue. But I think your community should be aware that scientists like myself and my colleague, our ability to do research has been severely compromised by the current administration.
Question from the audience, and this is from Thomas. Thank you, Thomas. Question about particulates that end up in the soil. So specific question is, when particulates fall to the ground, is there mercury and dangerous levels, and if soil samples been taken to measure such things? So maybe with all of the conversation about air quality, could you just talk a little bit about particulates in soil?
I can handle that one. So definitely, where there's coal burning, there's things emitted, so many of which we know about. So mercury is one of them. In terms of measurements in Omaha in particular, I'm not aware, although the EPA has recently done a lot of rulemaking about the amount of mercury emissions that are allowed from coal power plants. And certainly, what's emitted comes down somewhere. So if it's coming out of the smokestack, it's landing on the ground and then entering the groundwater, entering the surface water, and influencing things downstream. And in terms of like specific impacts from individual facilities, I don't have the modeling to sort of support any conclusions on that, but it's a important and real impact from coal power plants.
The just general explanation, we appreciate it. We have a combined question and probably last call from the audience, just letting you know. Go ahead, Ryan.
So I guess one thing to mention on that last one is I believe that the coal ash landfill is capped now at North Omaha Station, so that will be an issue they'll have to sort out if they do extend. So we got three questions that are all for Carl, I think, around rules around reliability and reserve capacity. So we often hear that the grid authority, the Southwest Power Pool, sets these rules on reserve capacity margins, and they give credit to some types of resources but not others. So Carl, if you wanted to say something about what the sort of resource options you've been putting forward do to kind of reduce that peak but also meet those accredited capacity requirements, and how this fits into the question of containing costs as gas prices are going up. Another question mentioned.
Yeah, well, obligations for reliability, what they call planned reserve margin, I think is the term that the SPP uses, the Southwest Power Pool, that is your macro grid that serves you guys, are measured at the delivery points for the utility, which makes them, my God, we have so many geeky terms, makes them load-serving entities. So load-serving entities receive their power at delivery points. There's usually more than one. It comes off the transmission to them, and the numbers are measured during particular times of the year, usually the times of peak electric demand, the 1 or 4 highest hours of the year, or highest hour of the month, 4 months in the year, whatever it is. So distributed resources, demand side management, energy efficiency, rooftop solar, storage deployed through a VPP to reduce load, all There are even companies out there, do not, if you're a student, I'm not sure maybe a statistician, there are load prediction, peak prediction companies. You can buy a service that will predict when the hottest hours are going to be, because this is very important to utility people. And so there's enough demand for it. If you hit those peaks, and you can always hit those peaks if you install efficiency, because efficiency works 24/7, then you reduce your load on the transmission system and you get a pro rata reduction in your planning reserve margin, the about over that you need to be able to contract for or generate for. Second, you can meet these reserve margins with committed power from others. This is not like you can only satisfy this with a power plant that you own and staff. You can put together a portfolio of resources, both local and long distance, that will allow you to ensure you meet those reserve margins. So there are solutions for an innovative manager who wants to look beyond keeping his power plant, that he drives by every day or whatever it is. There's a real psychology among utility people to try to keep these things. It's a control fallacy. I'm not going to go deep into it, but it's just utility people believe that if they own it and they keep the power plant running, they can control all things. They know they can't, but they really swing toward that. And there are ways to make things they don't completely control work with the system, and they should take advantage of that.
So we'll take the last question here. This can be for anybody. They're asking about what do you think are the likely political potential counter arguments against community-friendly policies, and whose job is it to ensure that those policies do get passed? So I think that with public power, that points pretty starkly at the board, but I'll let the panelists have their final words here.
Yeah, I agree. It's the power of the vote. It's the board. Yes, there are things governors and presidents and others can do, but it comes down to what do you want for your community?
Can we thank the public health and energy experts one more time for the audience? Sincerely, that's a lot of time and effort spending time thinking about our community. So we really, really appreciate that. And can we thank our organizers, Dr. Leo, Dr. Wishart, Liz VC, the programs. And you can just, if you didn't use your card, just leave it where it's at and I'll pick them up in a second. And we are adjourned for the evening. Thank you all for coming.